paradox. So obesity paradox, it was seen that in patient who generally, as we all know, that obesity itself is a risk factor for coronary artery disease or any heart conditions. So obesity generally had to have a lot of association with the heart disease, but it has been seen that once they develop a heart problem, the overweight or obese patients were found to have a better outcomes when compared to those patients who have normal weight. So this is all discussion about after developing some heart problems. So once they have developed the heart problems, the better outcomes are found to be better in obese patients when compared to the normal weight patients. So this is in line to compare to their BMIs. So they have seen that in various studies previously, higher BMI patients do well when compared to the normal BMI people. That is what is called as obesity paradox. So for this, various explanations have been suggested, including the fact that generally what happens is any patient when develop a chronic conditions or chronic illnesses or heart disease or anything, they tend to lose weight. So they lose some weight, and that's why patients with higher BMI have more tendency to lose more weight, and thus that has a small benefit in preventing them from complications and have better outcomes in them. BMI. So main problem here is that BMI does not take into consideration the location of the fat and its amount relative to the muscle. So that's why various studies after that, after the terminology when it came into picture, so various researchers have tried to find that is it really that case that obesity is protective or not. So they have seen that previous studies, obesity paradox was basically based on this body mass index. It doesn't take into consideration the fat distribution and the amount of muscle and weight of the skeleton and all. So that's why various studies after all, it has shown that various studies were done later on, which showed that when you take waist to height ratio or waist circumference, despite of BMI, so don't take BMI, and if you take waist to height ratio or waist circumference, so there has found to be not such benefits like that. So also was found to have a worse outcomes in this group of population. So waist to height ratio and waist circumference, they give better outcome of the body fat, and that's why these are the better tools to assess obesity rather than considering only BMI.